after coronavirus shut down the world. Now China reports bubonic plague, Black Death. A high alert has been sounded in a Chinese city after a herdsman in Inner Mongolia, China, is confirmed to be infected with bubonic plague. The world in the grips of a pandemic watches stunned as the deadly disease that has killed millions through history rears its head again in China.
Good evening, you're watching To The Point. Yes, it's right. A small city in a district in China has reported a 14th century plague, the bubonic plague, which has killed millions over the years, over these various centuries that we've seen. A world in the grips of a pandemic is watching stunned as developments take place in China. There is a high alert in that city as one person has been confirmed with bubonic plague. We're going to keep revisiting that story, getting our viewers the very latest, but I want to now quickly shift focus to the current situation. We're in the midst of a pandemic, and only one thing we know by now is working, which is testing, and more tests. Well, till now, there's only one test which is still the gold standard, which is the RT-PCR test. But a lot of states in India are now looking at the antibody test.
As the world moves to the next phase of response to a pandemic, testing is still the strongest line of defense. With real-time RT-PCR test considered the most accurate test for COVID-19. However, testing methods continue to evolve after RT-PCR test, antigen test and TrueNAT test. Now at least 3 states in India are resorting to an antibody test. So what is an antibody test? An antibody test or a serological test checks your blood by looking for antibodies, which may tell you if you had a past infection with the virus that causes COVID-19. Antibodies are proteins that will help fight off infections and can provide protection against getting that disease again. Antibodies are disease specific. For example, measles antibodies will protect you from getting measles if you are exposed to it again. An antibody test may not show if you have a current COVID-19 infection because it can take 1 to 3 weeks after infection for your body to make antibodies. The aim for antibody tests is to gauge the degree of herd immunity in a population. However, antibody tests in many countries, including the state of Rajasthan in India, have thrown up unreliable results wherein antibody kits fail to detect antibodies even when the laboratories had confirmed patients to be COVID-19 positive. The Indian Council of Medical Research has advised states to use antibody tests for surveillance and focus on real-time RT-PCR for results. Maharashtra, with nearly 33% of the country's corona-positive cases, is now getting antibodies tested in a big way, hoping to gauge herd immunity.
So ये कोविड एंटीबॉडी टेस्ट जो है ये सिर्फ नॉलेज के लिए है. ये डायग्नोसिस नहीं देता है कि आपको कोविड हो चुका है या होने वाला है, ऐसे नहीं है. प्लस आईसीएमआर जैसे एपेक्स बॉडीज ये टेस्ट कराना चाहते हैं ताकि कम्युनिटी में कितना सीरो प्रेवलेंस है ये एंटीबॉडी का ये जान सकते हैं.
After Maharashtra, antibody tests in Delhi and 3 districts of Haryana are underway. Diagnostic laboratory chains have now launched COVID antibody tests across India. The test is priced at ₹600 and the results can be expected within 24 hours. Widespread antibody testing gives authorities estimates on the rate of infection, also offer information on what factors affect the severity of infection, and why some people are more severely impacted than others. However, the antibody tests have been known to be thrown up false negatives. Moreover, an antibody positive test might give a false sense of security that the person has made antibodies against COVID. As till now, there is no conclusive evidence that a recovered person is immune to catching the infection again. So while the antibody test does not seem to be the game changer in gauging immunity to COVID, it still could feed data to formulate policy as India unlocks. Bureau Report, India Today.
All right, so there was a theory which was abound that the antibody test could actually be the game changer, especially for countries which are seeing a high rate of COVID-19. By conducting antibody tests, they'd be able to know how much in a community has developed what could be, say, immunity, and then gauge if, the cluster, the community can actually be going towards herd immunity. However, there has been recent examples of the antibody tests which have thrown up inconclusive results. So is it really reliable? Is it worth it that states after states now invest into the antibody test? I have with me Dr. Sanjeev Bagai. Appreciate you joining us. We'll be joined very shortly by Dr. A. Vellumani. She's the managing director of Thyrocare. But Dr. Bagai, I want to ask you, we're talking about the antibody test. Not till very far back, it was being talked about, this game changer in the world of testing, but it really isn't that game changer anymore, is it? Would you give us, the breakdown of what is the antibody test?
Good evening. It's important to understand that when you have a pandemic which is panning out in this nature globally and more so in India, and you are now in a phase which is post-lockdown with relaxation, it is very important to judiciously mix real-time PCR, which is catching the antigen. So it gives you a real-time diagnosis, and a judicious mix with an antibody test, either through ELISA or through CLS, different types of antibodies tests. The antibodies generally built up as a protein which are built by a human being to fight off from the host a foreign antigen, which is the COVID. This normally takes 5 to 7 days for the antibodies to start building up in the body. There are two different types of antibodies, but the antibodies give you a range of the complete cohort. The antibody test is the true test to give you a community surveillance, because it gives you a true insight into the mode of transmission. So you will have a more realistic data as to how many people have in the past come into the infection and how many are recovering. You would also be able to quantify what the asymptomatic load in the community is. The asymptomatic load, which is being spoken of very commonly now in the last many months, is a very important fraction of our community society as a percentage population, because they can actually carry the same amount of viral load for a much longer time and therefore continue to infect. There are lots and lots of data in which has shown that one single person who's an asymptomatic carrier can at an average in the community spread more than 200 times in a period of 14 days. So for us to gain a complete control in the community to stop the spread, identify, quarantine, isolate, and then identify, the antibody test is a very good and a beautiful test to be added on to a real-time PCR. It's also important here to stress that when you talk in terms of antibody test, especially from the asymptomatic or from the community, all data in the last 15-20 days has shown that the COVID infection is not only a droplet infection, it is truly an aerosol infection. So it's airborne. To say it's airborne means even a sub-micron level particle can spread more than 6 to 8 feet, even up to 20 feet. And the smaller particles go very deep into the lungs to cause very rapid pneumonias. So to identify the target population, antibody test is extremely important. It was earlier showing a low sensitivity. There were some faulty kits.
Right, Doctor,
but the present data which is shown is that the antibodies are a near 100% sensitive and specific.
All right, I have Dr. Vellumani as well. He's the MD of Thyrocare. Now, one of the first labs that is started doing antibody tests is Thyrocare. Dr. Vellumani, what is the procedure? How long does it take? How long does this test cost? And why should somebody get it? Of their own volition, because states are doing it today to possibly gather data, whether we are in herd immunity or what are the numbers we are looking at. But personally, why should somebody get this test?
Yeah. No, as I just now heard the other speaker telling that it's highly sensitive test, highly specific test. It is both available in ELISA as well as chemiluminescence. This is not the same test which was done 2 months back, what is known as a rapid antibody test that had challenges. These tests currently are used, are good test, most reliable test. Having said that, without an antibody test, one would ever not know whether this virus has completed a part of the journey, how much it is. We have done so far around 13,000 investigations in antibody testing, and we have observed around 8% to 9% of the general public is having antibodies, even without having an infection and admission in hospitals. As doctor said, it is probably going through not only just a kind of big droplets. It is reaching to all people who are on the road, on healthcare workers, or people working from home have less positivity. People going to office daily have more positivity. People on the road like police and security have higher positivity, and even high positivity is the healthcare workers, though they have never got admitted in any hospital for positivity.
Right. You know, Doctor, I want to go back to Dr. Bagai, and I'll, pose the same question to you. Dr. Bagai, would this test not give maybe a false sense of security, because till now there is no data to substantiate the fact that somebody who's recovered from COVID cannot get the infection again? So, one might get the test and say, I have antibodies, and not take precautions.
Right. So there are two parts to your question. It's a very, very critically important question. One is with regards, do you have immunity and how long the immunity lasts? And the second is opening a gamut of discussion with regards a community herd immunity. Now, with regards to your first part of your question is how long do the antibodies actually last in the body? There is recent data which has been published just this month, in fact on 3rd of July, which has shown that a vast majority of patients after contacting COVID have only a partial immunity. 79% of people only have partial immunity, which only lasts for about 2 months. And after 2 months, the antibodies go down. With regards the antibodies, how they actually act, the antibodies generally act within 5 to 7 days and start protecting the human being after you come in contact with a foreign antigen. Now, when you come to a large community in terms of a herd immunity being developed, there is data recently again published in which it shows globally most countries have only reached about a 5 to 8% protection as far as the entire community is concerned. In fact, New York has the highest test of antibodies of about 19.5%. We need about 60 to 65% of an entire community to develop herd immunity. So it's important that we continue to test with antibodies as a community surveillance. Increasing numbers of tests being shown positive is not a bad sign. It's not an ominous sign. It's a very good sign because you can actually capture the entire cohort of the people who are recovered and people who had the past infection. So it is important to continue to test with antibodies, diagnose with real-time PCR, and with both these as a synergistic combination, we have an ideal weapon to identify and therefore have a containment strategy.
Dr. Bagai, one more question, because before I go back to the MD of Thyrocare, because it's one of the labs which is conducting these tests, would you recommend individuals to actually go and get an antibody test, or do you think it's best, that the government does it in states to actually gather information, data, which could now possibly help collate policies as we go forward in unlocking? Would you recommend individuals getting it, or would you think it's best that, states do it as an exercise?
Again, an important question. I have said this for many months and I'm extremely vocal in my views, is that we need to mask our face and unmask and unlock the testing. So we need to make this test available to the largest section of society. This test is not as expensive as real-time PCR, the antibody test. You have a result within a couple of hours. It gives you a very high sensitivity and specificity, and the duration of period of pickup of the antibodies is a much longer duration. Your real-time PCR is available as a diagnostic test for about 9 to 10 days out of 14 days. So it also gives you a much better pickup in terms of accuracy as sensitivity and specificity. So the antibody test should be available for the general public. It should be available in government and private hospitals. Someone who needs to get it done the freedom should be given to get it done, but it is important that the data should be captured so that the government can then intervene and have an analytic analysis as to who needs to be identified, who needs to be tested further.
All right, so I'll go back to the MD of Thyrocare. So now your lab, sir, doctor, has started this test. Would you give us what exactly is the difference between, say, this particular test to, say, an RT-PCR test or an antigen test or a TrueNat test? What is the difference between this and those? How much quicker, sooner can you get the results? And what is, what do you actually do? What is the process?
Let me answer to the previous question. Government also should spend for knowledge, because government should not wait till individuals spend and give knowledge to them. Individual can spend if they wish to have a confidence they have some immunity power with them. So it is not that one will and the other should not. Coming to your question, there is a terrorist, that is the virus, and it gets into your body. So all your PCR test, antigen test, TrueNat test, all are finding out whether in your lungs still there is a terrorist or not. Antibody test is like security force. This security force act against the terrorist. So don't compare that. One is tracing the terrorist, another is finding out the quantum of security force available in your body in layman language. So there is no comparison. Antibody test is very much important, essential for us to study. Let me also explain you. The antibody levels, even if you vaccinate, will not remain too high for too long. This virus is silently, freely immunizing. And let me tell you, when you are immunized either by the virus or by the vaccine, you have a strength by which in future, if one more infection happens, your body will react fast. And if somebody thinks no infection will not happen, he is having a wrong belief. So people should understand and then use it. A lot of awareness is needed, and it has to be taught to people.
All right, okay. I'll take just two final questions, because everybody out there, a lot of people, would want to go and get an antibody test to know if they've actually built immunity against COVID. But, we want to make you aware from every possible facet of this test. And Dr. Bagai, what if somebody has contracted the virus, is asymptomatic, gets an antibody test, clearly his body hasn't still generated antibodies, and that's, comes negative. That would be also, a false sense of security, because this person could be an asymptomatic carrier who yet's not developed antibodies.
Yeah. So my suggestion in as far as your antibody testing or a person who has a desire to go and get it tested is, please consult your local doctor and then go and get it tested. The timing of the test is important. So if you get an antibody test done within, let's say, theoretically you've been come in contact a couple of days back, and within the first 2 or 3 or 4 or 5 days you go and get the test done, yes, it will come negative. So that's a false negative. You may still be carrying the infection. So the timing of the test is important. I think apart from the antibody test being rampantly available pan-India, it's extremely important to have a national public campaign for awareness that 3 things are important. S, M and S. That's an SMS, that's a simple thing to remember. That's social distancing. Please wear a mask continuously and sanitizing. And avoid the dangerous C's. The dangerous C's are clusters, crowds, closed spaces. Do not put your guard down. Relaxation of the lockdown doesn't mean relaxation of the precautions.
Right. All right, okay. So appreciate you doctors for joining us, the MD of Thyrocare, Dr. Velumani and Dr. Sanjeev Bagai. Ultimately, if you want to get an antibody test, go ahead and get it done, because a lot of us are going out there. We're very apprehensive. The country is unlocking and most of us are going to work. Get it done. It's cheap. The results come out quickly, but don't rely on it. It can be giving you a great sense of security, which is not yet there. Follow every precaution which is already established. Social distancing, wear your mask, get out there with your mask firmly on. Appreciate you both for joining us. I want to end the show and to the point this evening. I want to end with visuals of the Taj Mahal. As monuments across India today, most of them opened up, the Taj Mahal has remained shut. It was to open up today, but the Uttar Pradesh government, in view of rising COVID cases in Agra, has decided that the Taj Mahal will not open to tourists or even the Agra fort, as a matter of fact. Both the monuments have been shut since the lockdown began in March and will continue to be shut in days to come till the Uttar Pradesh government reverts. But these are visuals that one are not used to, haven't been seen in recent times when it comes down to the Taj Mahal, because it's seen huge crowds. But right now, Taj Mahal is still under lockdown. Thank you for joining us. Good night. Hi everyone, Preeti Chaudhary here. Hope you like this video. For latest news and analysis, like and subscribe to the India Today YouTube channel. And don't forget to press the bell icon to stay updated. Thank you for watching.